In tonight's big edition of Health Connections, we learn about a way you can overcome vertigo or dizziness. Coming to you now from the Grand Island Balance, Mobility, and Aquatic Center here for Health Connections. Travis Hedman joins us now. Good to see you, Travis.
Nice to see you, Seth.
And we're dealing with vestibular rehabilitation. First of all, that's quite a handle. What are we talking about here?
Vestibular rehabilitation is a specialized form of physical therapy. It works on basically the inner ear and the central nervous system, and it's our sense of balance and position in space with our head. So it's one of the many systems our body uses to help keep our balance.
So we're talking about vertigo, dizziness. It helps a lot of people with that, right?
Correct, yeah. There's a couple different types of vertigo and dizziness. I tend to think of those two as kind of catch-all phrases for a whole host of symptoms that a person can have, but vertigo generally involves an inner ear canal problem, which can be treated quite quickly and with a couple simple maneuvers. Generally folks get better fairly quickly. If it's more of a central weakness with the part of the central nervous system that the vestibular system works with, treatment can be done, and it's more of an approach of teaching the patient to compensate for their dizziness and not have that anymore.
Talk about the vestibular system. What exactly are we talking about here?
Okay, so you have 3 canals on each side of your head in the inner ear, and in those canals are some gelatinous material and some crystals, and based on the position of your head and how you move your head, that stuff moves around, and when it does that, it sends signals to your brain stating that my head turned this way or my head turned that way. That's the outside part of the vestibular system. The inside part, or the central part, is the nerves and the part of the brain that transmit that information and process it and make sense of it for us. So you can have a peripheral vestibular problem or you can have a central vestibular problem, both of which could result in vertigo or spinning or just kind of a vague lightheadedness, dizziness, off balance feeling.
It can really make life difficult. Now this rehab that they go through right here at your office, walk us through what this looks like.
Okay, so we would start with an initial evaluation, talking to the patient, figuring out what kind of symptoms they're experiencing. Is it that true spinning, or is it more of the lightheaded and vague dizziness? We get a history from them, including their health history, to see what any factors might be contributing to their dizziness symptoms. And then we go through a evaluation with some special goggles, video infrared goggles. And that helps us look through at what their eyes are doing, and based on what their eyes do when we put them in different positions, tells us where the problem is with the vestibular system. So we can assess it through their eye movements with these specialized goggles.
How many trips to see you does it take?
Depends on the problem. Like I said earlier, with a peripheral problem with something in the canal, it might only take one treatment. I've had many patients that have had one treatment, and the next time they come back for follow-up, they're having no symptoms, they feel great, and they're done. It might take 2 or 3 to do that. With the central problems, that's again more of a repetitious teaching a patient to compensate for their vestibular weakness, and so that might be more like a 2 to 3 times a week for 4 to 6 weeks before we get them there. So